At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. A head-to-toe assessment is a fundamental part of a healthcare professional's role in patient care. It's a thorough examination of the body, often referred to as a complete health assessment, that gives you a clear picture of your patient's overall health. This assessment allows you to detect potential health issues early, monitor ongoing conditions, and create personalized care plans tailored to each patient's needs. Conducting a head-to-toe assessment isn't just about ticking boxes, it's about understanding your patient's health history and current status to ensure they receive the best care possible. By identifying any potential problems early on, you can intervene quickly, which leads to better outcomes for your patients. Now let's break down the steps involved in performing a head-to-toe assessment. Firstly, gather patient information and vital signs. Start by collecting the basic details: name, age, gender, height, weight, and the reason for the visit. This initial step also involves recording the patient's medical history, including any current medications, allergies, and recent tests. This gives you a foundation to work from as you move through the assessment. Head and neck assessment. Begin with the head and neck. Look at the scalp for any signs of injury, check the hair for cleanliness, and examine the face for symmetry. Don't forget the eyes. Check their clarity and reaction to light. Inspect the ears for any abnormalities. Feel for swollen lymph nodes and check the nose and mouth for any signs of infection or congestion. Make sure to document all your findings. Chest and lungs assessment. Move onto the chest and lungs. Check the chest for shape and symmetry and listen to the lungs with a stethoscope for any unusual sounds like wheezes or crackles. This step helps you assess the respiratory health of the patient. Cardiovascular system assessment. Next, assess the cardiovascular system. Listen to the heart, checking for any irregularities like murmurs. Check the strength and equality of peripheral pulses on both sides of the body, and look for signs of swelling in the lower extremities. These observations can reveal a lot about the patient's heart health. Peripheral vascular system assessment. Evaluate the peripheral vascular system by observing the texture and color of the skin, particularly on the hands, arms, and legs. This step also involves checking for any abnormal patterns of veins and hair distribution, which can indicate underlying vascular issues. Abdominal assessment. Next, examine the abdomen by gently palpitating it to check for tenderness or swelling. Listen for bowel sounds to ensure they're normal. This step helps you assess digestive health and identify any potential issues in the abdominal area. Musculoskeletal system assessment. Evaluate the musculoskeletal system by observing the patient's gait and checking the range of motion in their joints. Neurological system assessment. Now assess the neurological system, check the patient's mental status, alertness, and reflexes, and examine the cranial nerves. This step is crucial for understanding the patient's nervous system health. Genitourinary system assessment. Finally, examine the genitourinary system. Look for signs of infection or abnormalities in the genital area and review the results of any urine test. This step is vital for assessing the health of the urinary and reproductive system. Document assessment findings. After completing the assessment, review your notes, discuss any concerns with the patient, and develop a care plan as needed. Here's a sample of our head-to-toe assessment to give you an idea of how it can be used in your practice. To explore more of our free templates, visit our template library on the Carepatron website, linked in the description below. Carepatron is a practice management software known for its comprehensive features, and signing up is free. Just click on the sign up link in the description. If you found this video helpful, don't forget to like and subscribe for more content like this.